Welcome to one of the final social equity series installations. As you know, social equity series goal is for us to really talk about social equity and how it is impacting and being talked about in different parts of the agency. Today, Josh Roll is going to share with us and then give us an opportunity to ask questions. If you have questions, you of course can put them in the chat, but you also can use Slido. So using Slido, you just go to slido.com and then you do hashtag or number sign or pound, whichever one makes sense for you. And then social equity, and you can ask questions in that space as well. I'm going to kick it over to Josh in just a second. Would love for Josh to introduce himself, his role at ODOT, and also Josh, in your intro, if you could just tell us a little bit about how you think about equity or define equity in your space. And then I believe you have a slideshow, right?
Yes.
Okay, so if Susie, I don't know if he can share, but can we just make sure that he can share his screen with everybody too? And so we are going to kick it off with Josh Roll. Thank you.
Thanks, Nikatris. So I'm happy to present today on some of the things that we've been working on in the research office that relate to social equity and transportation safety, and specifically pedestrian injury. I'm going to hold my response to your questions until we get into a little bit about me, just so I'm not recognizing a lot of names on here, so I think there's probably a lot of folks who don't know me or the office that I work in. So today we'll go through a little bit of who I am, talk about the session objectives. And what I really hope to accomplish today is giving folks in the session a sense of why ODOT should care about social equity. I know this series has been going through a lot of those reasons, and so I hope to add one that's really important and that I focus on with transportation safety. Because I felt that in some of the conversations we've been having, especially over the last 12 months, some people arrive at the table around this conversation around social equity about like, well, yeah, it's important, but how does ODOT have a role to play? And so I'm hoping today to describe some of the evidence around pedestrian safety and how that really directly affects our business lines. And I'll be going through kind of this current injury disparity, pedestrian injury disparities. So someone's got their music on, or maybe it's a ringtone. So I'll go through the evidence that we have both here in Oregon, but then also within the broader research literature, and talk about, really why, what the theories are and what some of the evidence that we have to answer the question about why these disparities exist and kind of what we're calling injury disparity pathways. And then I'm hoping to get through a lot of this with time for us, lots of time for us to talk. So who am I? I'm a research coordinator and data scientist within the research unit. At the research unit, there's about 8 of us who coordinate and conduct research. I focus a lot on bike and ped activity. Broadly, it's active transportation and sustainable transportation. I have a background in travel modeling, land use, air quality modeling, work at doing just basic travel monitoring. And so like rudimentary things like how do we count the users in the system, including people who walk, bike, and take transit. There's inherent connections with safety analysis because of that active transportation role. A lot of the reasons like that people don't walk or bike more is because they feel unsafe. And so we do a lot of work understanding how different safety interventions, different types of projects can make it safer for active transportation users. A lot of work I've done includes things around like how to reduce emissions from greenhouse gases. And then I have a background in things like life cycle cost analysis. How do we measure the overall benefits of our maintenance facilities that are maybe cleaner and greener versus those that we used to build in a more traditional fashion, among some other background areas. In terms of equity training, I've had little, but I'm very eager to learn, and I've been doing my best to learn outside some of the official channels. And this project that I'm going to talk in some detail today has given me a lot of good lessons, I think. And But I say this because I'm still working on, making sure that I'm describing a lot of the social equity landscape properly. Things around language and terms are things that are still not, I think, totally internalized for me. So I might make mistakes, and I look to grow those skills continuously. And so I just want to put that out there. So today, we'll walk through a few of the objectives, but we're mainly going to be talking about some work that's ongoing at the research unit and how that sort of fits in with some of the broader work that ODOT is doing. I really, again, want to show why social equity should matter across our business lines, especially as we think about pedestrian traffic safety. Some key elements in these objectives, though, are to sort of describe the current picture of pedestrian disparities in Oregon. A lot of the research that comes out on this is national or maybe in another state or another city, and so I'm hoping to give folks of the sort of broad information about what the picture looks like in Oregon, so that we can say with more precision how social equity, disequity is impacting pedestrian safety outcomes, and talk about why these outcomes might exist. We have data limitations in certain circumstances, but I think there's still a lot that we can say. I do just want to point out that we're going to talk a lot about how race, income, impact, and relate to these pedestrian injury outcomes. But just to be sure, crashes are very complex. They're somewhat random in nature. There are systemic causes to them. That's well documented. But I don't mean to describe our findings here as the panacea for why all pedestrian injuries occur, because there's lots of reasons. But I do believe that social equity and some of the ways that we've built our environment and we operate in the environment connect with social equity and disparities and have a big influence on pedestrian injury outcomes today. So a little bit about the work that we're currently doing. Since about the middle of summer, we started a research project funded through our research office with a large part with support from the director's office. Travis Brower was a champion for the initial research proposal for us to essentially understand what this picture looks like in Oregon for pedestrian injuries. What are the disparities? How can we measure them? What are the limitations in the data? What do we need to gather? But to clarify the picture. But what does this picture look like now? And a second objective of, has it gotten worse? Has it gotten better? And how can we wrap some of these findings up for an ongoing planning effort that's the Transportation Safety Action Plan. And so this is a federal planning document that we do every 4 or 5 years to sort of like put together all of our policies and strategies and actions for how to reduce fatal and severe injuries and get towards our goal of 0 of those incidents. And so understanding the picture of how social equity impacts pedestrian injury outcomes, has it gotten worse, has it gotten better, and wrapping those up for the TSAP process are sort of the main objectives. And, I think it's worth saying now that in October, the Oregon Transportation Commission published their strategic action plan. And within that, they directly acknowledge the existence of pedestrian injury disparities based on, neighborhoods with lower people of lower income status and people of color. And so I think it's great timing for this project because it's fitting into some of the higher level leadership vision of trying to take equity into our business lines and be more thoughtful about using this lens and some of the work that we do. I do want to acknowledge that, there's a few different parts of ODOT, to my knowledge, there may be others, that have been kind of out front on this for a while. And, one of those groups is the Active Transportation Unit that has developed some multi-criteria selection tools for like where we're going to build projects. And within those tools, they have considered some measures of equity, income, race for a while. And that a lot of that started with folks like Jessica Horning, who now leads the active transportation group, who I think were out front trying to think of these things. And the other effort that I'm aware of that I think is important to mention is the work that the former Transportation Safety Division folks are doing with the arts program and the pedestrian safety implementation plan. They don't include race and income specifically, but they are looking at trying to figure out where projects should be built based on underlying systemic causes, which I think is a really important step for us to stop looking at where the crashes are. That's important, but there are these underlying factors that I think we need to better consider because crashes are somewhat random in nature, even though there are these underlying systemic causes. And so just want to point those two efforts up because they're important and they're doing good work. And we are hoping to support some of that either at a high level through sort of the, painting this broader picture and even at a more disaggregate level by coming up with more refined methods, analytic methods to use social equity lens to do project selection. And so a little bit of the project background, but now just sort of hopping in, to this question about why social equity should be important for ODOT. And the chart I have up on the screen is really our best direct measure of pedestrian injury disparity by race in Oregon. And so,
Josh, we can't see your screen.
Oh no, has that been going on this whole time?
Yes, but until you just said the thing I have on the screen, we didn't know we were supposed to be looking at.
Okay, interesting. Okay. Well, good. I guess you were probably listening to every word I said instead of looking at can you see anything on the screen now?
Yeah, we see pathways to pedestrian injury disparities.
Okay, great. Okay, well, I don't think you missed too much. Just some words on some screens. And again, hopefully you're listening to my words instead of looking at pictures. But so thank you for saying something because the picture in this case is really important. And what we're looking at is a chart of fatal pedestrian injuries by race, normalized for the population. So the way to think about this is like how you would review like the burden of disease, like heart disease or diabetes. The number of cases per 100,000 people in the population. And so what we see here are the pedestrian injury rates by race. And starting on the left with the census and federal safety groups race categories. See, the American Indian and Alaska Native rates are higher than the Oregon average, which is presented on the far right. Oregon average, on average, there's about 9 pedestrian injury deaths per 100,000 people for this time period of data. And this is our best contemporary data, represents data from 2014 to 2018, 5 years of data. So American Indian and Alaska Native rates are higher than the Oregon average, as are all the other Black and Indigenous and people of color race categories. So Asian, the rates for Black Oregonians are the highest, and Latinx are also higher than the Oregon average. And so what we can do with these numbers, we can also put some level of confidence on our measure of pedestrian fatal injuries, and so those are represented in the bars and the margins of error bars. And one of the things that we struggle with, and that I've struggled with as an analyst when we're doing work around race, especially in Oregon. Oregon is a very white state. We have relatively smaller populations of people of color, and so sometimes when we're doing our analysis, the margins of error are so large that it's hard to say anything meaningful about an outcome. And so I represent the pedestrian fatal injury rate here for Native Hawaiian and Pacific Islanders, but it's, as you can see with this margin of error bar, very large. And that means that number that I show, 23 deaths per 100,000, is really unreliable. I show this number, my epidemiologist friends say, you got to mask this out, it's too imprecise, you can't show it. And I feel weird about that because I feel like we could aggregate this with another category, but it feels weird to sort of like disappear people out of the discussion. And so I leave it in here. as a way to also bring up the issue of statistical precision and the difficulties we have in Oregon because we have such relatively small numbers of people of color. But we doesn't mean that we can't say something with confidence for a lot of the outcomes that we're measuring, including the measures for these other race and ethnicity categories. And so the punchline of this chart is that we can directly measure pedestrian death rate disparities in Oregon. And there are measurable disparities with Black Oregonians revealing the highest disparity and with the others that follow that I've somewhat described. And so so this is, again, meant to show like this is why should be important to us, because as manager of the transportation system, along with our partners at the local level, we built a system and it's complicated. There's a lot of things that go into it that are creating disparities, and we should try and figure out what's going on here. And so the way we're sort of summarizing the causes, if you want to think of it that way, come down to what we've described as pedestrian injury disparities. And within those, there's two pathways that we've described. The first pathway is that, there are more people walking and taking transit in communities where there are higher concentrations of low-income people and people of color. We'll get into these details a little bit more and show some of the evidence for why we know this. But the other pathway, and this is a little less well documented, at least in Oregon, is that this activity, walking and accessing transit, and even riding bikes, even though we're not talking specifically about bikes, but that activity is happening in built environments that are just much less conducive to safely using those types of modes. And so, walking more in neighborhoods that just have more vehicles, driving on the streets, wider streets, and vehicles that are moving more quickly. And then based on research that we have from other states, likely doing that activity within neighborhoods that just have less pedestrian infrastructure features, things like sidewalks or high quality sidewalks, crossing features, pedestrian lighting, traffic calming, those sorts of things. And we're going to get into both of these a little bit more about how we can measure how we can measure more of the travel activity by these non-motorized modes, and then also how we're measuring sort of the friendliness of being able to walk in some of these communities. Because so we showed the earlier chart about pedestrian injury rates by race, but it's really important to know that race we should lead with. Race is on top of other things, sort of a contributing factor for some reasons that we'll get into, but income is also really important. And so one of the ways, but we don't measure income anywhere. We're lucky that we have the pedestrian participants race included on a federal data set that we can then use to create that chart on injury disparities by race, but we don't have income. So the best that we can do is look at the census tract where the pedestrian was struck, and use that information as a proxy for at least what's going on at the neighborhood level. But I think there's significant evidence that we can use to say that pedestrians are probably being struck with some proximity to their home, and therefore relating that injury outcome to the residential information on the tract is sensible. And so the chart that I'm presenting here is just looking at, if we categorize all the census tracts in the state based on whether or not the poverty rate is higher or lower than the state average, and whether or not the proportion of the population that is BIPOC is higher or lower than the state average. We can categorize all the tracts. There's about 834 in the whole state. We can say, is this tract, does it have more people of color and more people that are low income than the state average, or less? Categorize the whole state, and I'll show a map in a minute of kind of how that looks. And then we can calculate the population-based pedestrian injuries for each of those tracts, and then summarize it in this chart and say, we can say something about how race and income at the tract level are related to pedestrian injury outcomes. And so what we see in this chart is that for tracks that are classified as having lower amounts of people of color and low income populations, the pedestrian injury rate is much lower than the state average. And so that's that orange bar. And the orange bar is about 13 deaths per 100,000 people, much lower than the state average, which is shown in the dotted line. The yellow bar is more people of color and more people living in poverty, but still less than the state average. And then, so you can see how the injury rate increases as you go to tracks that have higher concentrations of low income people and people of color, with, the punchline here being that the tracks categorized as high have almost 3 times higher pedestrian injury outcomes than the lowest category. To give you a better sense of what this categorization scheme looks like, I show this chart here, or this chart and this map, to highlight how, once we apply this categorization across all the tracks, you can see, a lot of folks based in Salem, they can see the map here looking at Salem, which tracks are considered high, which tracks are considered low and lowest, and so forth, just to give you a sense of what this categorization scheme looks like and means. Getting to a little more detail now, showing that chart and then a table with the summarized elements that go into it. You can see here how, again, just reiterating kind of what this categorization means and what goes into it. You can see that, in all the tracks that are categorized as low, the average percent of the population living in poverty is only 8%, whereas the state average is 14%. For people living in the lowest, the tracks categorized as lowest, the average percent of the total population in those tracks that are people of color is just 10%, about half of the state average. And so again, these categories are just representing tracks that are places where the concentration of low income and people of color is higher or lower than the state average. For the high track, you can see that the average percent of people living in poverty is 23% for these tracks. And so, about 9 points higher than the state average. And for the percent of the population that's living, that are people of color in those tracks, it's 33%, or about 13%. It's 13 points higher than the state average. The number of people who live in tracks classified as high is over 1 million. 1 million people. And so I showed some of those summary measures here in the rest of the table, just so people who really want to look at these data points have an ability to do that. And you can see the total population that live in each of these tracks for each of these categories. And I also summarize the injury rates, which are also shown here in the chart. So, what we can say about this summary is that, in tracks with higher concentrations of people of color and low income people, the rates of pedestrian injury are higher. It's tough for us to connect the pedestrian who struck to where they live. We don't know that yet, although we have some research that's going on from a different project that we're hoping to make some of those connections. But, based on, and I'll make this point later, one of the contentions that some people have had with this approach is that, well, just because somebody is struck in a neighborhood that's low income or, has a higher concentration of people of color, doesn't mean they live there. And that's fair. We can't necessarily do that. But as you can see, just looking at the map of Salem, it's possible that you lived in any one of these high concentration level tracks. You might, and your average trip distance is a mile or maybe a mile and a half, you might still be in one of these neighborhoods. And so we can't say for sure that the people who are struck in these neighborhoods actually live there, but there is some evidence to suggest that there's a connection to their home. I mean, there's been some research that shows that pedestrians are struck, half of pedestrians are struck within a mile of their house. And so a mile is kind of big, but still gives us, I think, some sense of whether or not the pedestrians are actually being hit in their neighborhoods and being able to connect these two. Hopefully all of that is clear, because this is another one of our better pictures of what the state of injury disparities look like in Oregon. Because now we're going to move on to talk through about some of the reasons that these disparities exist, at least based on the data that we have. So we talked about the pathways to these injury disparities. And the first pathway that I noted was that, people in these communities walk and take transit more. Travel activity, having, as a recovering travel modeler, travel activity estimation is very complex, but what we've known for a really long time is that income is a big predictor of your choice to drive and how much you drive. And so what I've summarized here in this chart, it comes from the census and summarizes the percentage of workers that commute to work by walking, biking, and taking the bus, or taking transit more generally, actually. And in the lowest set of bars here, this is the percentage of people who live under the poverty line that commute to work by these non-vehicle modes. And what we see here is that for people living under the poverty line, the rate people who are living under the poverty line, 22% of those workers commute using these non-vehicle options, compared to just 11 or 8%, depending on, I've also broken this out by white workers and BIPOC workers. There's not a big difference in BIPOC versus white workers. I wouldn't expect big differences because, again, I think it's income that are really driving these travel choices, as opposed to any cultural or racial differences, at least from the evidence that I know. And so you don't see major differences between these classifications of workers, but you do see major differences as you move to less poverty, right? So for BIPOC workers who make 150% of the live in households, 150% of the poverty line or more, only 11% of those workers commute by non-vehicle modes, whereas that rate is double for people who live under the poverty line. So, this is one data point that we have that shows that people in these communities are walking, biking, and taking transit more often. Another piece of evidence we have comes from a national survey of travel activity, the National Household Travel Survey, and shows here, some of the reasons why people choose, or one of the reasons that people choose to walk and take public transit is because of the financial burden that vehicle ownership and operation present. I think at this point, the AAA estimates that the average vehicle ownership cost is like $9,200 a year per vehicle. And so, for somebody who's in a household that only makes $15,000 a year, that's a significant amount of money. And so they're more likely to be walking, taking transit because of the cost of automobile ownership. And so what we show here is, whether or not people said that travel is a financial burden based on income, people making less than $25,000, 55% of the people in this survey said that travel is a financial burden. And in that income group, 29% said they walk because travel is a financial burden. And similarly, 21% said that they take public transit because travel is a financial burden. And you see how that changes across income. Based on race, some of that same picture presents itself where, white people are less likely to claim that that travel is a financial burden, and then, sort of do these non-vehicle travel activities because of that. And again, I don't think that you're seeing a lot of sort of cultural differences or anything like that with the race outcomes. I think it's very much tied to income. And I'll touch briefly, and though we don't have time to really get into it, why poverty rates are different for different groups of people based on race and ethnicity. And a lot of that is historic. A lot of those historic things still exist. Don't have a lot of time to get into that, but that's some of the undertones here and explaining these differences based on race and ethnicity. So pathway one is really about people in these communities walk more, take transit more, and therefore are just exposed to more of the vehicle hazards that are presented to them when you're out walking and using non-vehicle modes of travel. The second pathway is that they're doing that activity in environments that are more likely to have a deficiency in the pedestrian system. And so we don't have great data, admittedly, for Oregon. We don't have a comprehensive database of where our crosswalks are, where our sidewalks are, where our traffic calming devices are, where all these pedestrian safety features are. And we're hoping to get at that in the next few years with a couple different efforts, but we don't have great data. We have some measures of sort of sort of the built environment from a couple different data points that I'll present in a minute. But what we do know from national research is that areas with higher levels of poverty and lower educational attainment rates are less likely to have sidewalk projects implemented. There's been research done on that. And that, sidewalk completeness is higher in high income areas. And so there's some evidence from the national level that would lead us to believe that the pedestrian system is less complete in low income neighborhoods and communities that have higher concentrations of BIPOC populations. Going back to this this categorization exercise that we did looking at census tracts in Oregon, one of the things that we can do is look at some of those measures of both race and poverty. So we have here for a given census tract in Salem that has this high designation, high concentration designation. We see that we can measure the amount of commute. What percentage of the workers commute by these non-vehicle modes, non-drive modes? About 2.3%, not huge actually, but what their exposure is to arterial VMT. Arterials are roads that are built to move a lot of cars and move them very quickly. So sort of exposure to that vehicle travel is going to put you at a higher risk than if that VMT was lower. One of the other measures we can summarize on data that we have available is the number of households that do not own a vehicle. And so what we show in this particular tract is that in this particular high concentration level tract is almost 10%, just over 9% of households do not own a vehicle. Conversely, a tract designated in the lowest category, sort of over here in Southwest Salem, just outside, I think it's within the UGB actually. Whereas the poverty rate was 30% in the high tract, poverty rate is only 6% in this tract. BIPOC population in the blue tract, in the high tract, is 46%, a quarter of that in this other tract. And what we see is these other measures, that are representing these disparity pathways, more walking, more exposure to vehicle volume. We can see that, whereas, the vehicle ownership was just, the number of households with no vehicles was 9% in this high concentration tract. Only 1.9% don't own a vehicle in this tract. And so from that, we can surmise that those people are probably driving more, whereas these groups are probably driving less, taking the bus less. We have other measures too, that I'll summarize here at this aggregate scale. And sorry if I'm getting too much into the details of the data, but I think it's important for us to see the evidence, to understand some of these outcomes. So this is sort of a mega table of a few more measures, a few that I've shown earlier, just around the summary of the race and poverty measures here by these. I have this called social vulnerability, but that should just be the same measure of race and poverty kind of concentration. Some of those injury outcomes. And then here we just have the measures of some of these sort of built environment measures that we actually have access to. And so we have, arterial VMT density. What you see here is, the millions of miles of VMT on arterials for these different categories is much different, right? It's almost 3 times more exposure to arterial VMT in the high category versus the low. High-speed roadways, miles of roadway that are posted at 45 miles an hour or more. It's almost double the low category. And then in terms of travel activity measures, we don't have great data, and I'm going to make that point again and again. But what we can say is that there's more transit stops in these tracts that are classified as high. The percentage of people without a vehicle, we have summarized 12% of households in these high designated tracts don't own a vehicle versus just 3%. So, a rate of about a difference of about a factor of 4. And then the percent of people who commute to work by walking and transit and biking. That's an error. I should have biking in there too. Sorry about that. It's over double of the workers in these tracks commute to work by a non-vehicle mode. And, just making the point, it's a lot of people who live in these tracks. This is not a small number of people. This is not a minority of people. This is about a quarter of the population. So that's a little bit about the injury pathways. And one of the other objectives that we had in our research was just to say, are these disparities getting worse? Is this overall picture changing? And so just showing one of the charts we showed earlier, looking at the 2014 to 2018 data on the right panel, compared to more historic data from 2008 to 2012 in the left panel. We can see that the overall average of the state is growing. The total number of pedestrian injury, fatal and severe injuries is growing faster than the population. We know that. And then across these different categories, we see that the changes, that every category is increased, but that the moderate and high designated tracks are increasing faster. And so whereas the lowest and low group are increasing by about 1 to 7%, the moderate and the high group categories tracks are increasing by 18% and 13%. And so they're growing at a disproportionate level as well. And just to, try to get wrapped up here, so we can take some questions if anyone has any. These findings are consistent with some of the broader literature that we've summarized as a part of the research project. There have been about 20 studies looking at this question at the census tract level of how race and ethnicity relate with pedestrian injuries, how income and poverty relate, and some of others kind of social vulnerability measures like English proficiency. And so this really fits within broader research findings that have been done over the last 20 years or so. And in fact, there was a really good study done by Federal Highways, by a unit of Federal Highways in 2018 that looked at the whole country and just where fatal injuries occur, and found very significant results that showed that, for every 1% increase in the percent of the population at the tract level that are non-white, BIPOC or Black or Latino. I mean, it was sort of consistent for all racial groups. The probability of pedestrian fatal rate went up by a similar margin of about 1%. And so significant findings across the country. The work that we've been doing very much fits within some of the findings that have been done elsewhere. So just to summarize, we know that income and race, that we're detecting these disparate outcomes based on race and income. And we know that people in those communities are walking more, taking the bus more. And we also know that their exposure to at least arterial vehicle volume is higher, and high-speed vehicle volumes are greater in those communities. But we don't have great measures for, again, crosswalks, sidewalk completeness, those sorts of pedestrian system amenities. And so, when we got into some of the more rigorous statistical analysis, and even this more simplistic, approach, I think what we're really measuring is, with race and income, they're proxies for the missing system elements, and they're also proxies for more of the pedestrian activity. And I'll make that point probably one more time. What we didn't get to cover today in any real detail, and I think some of the other series touched on them, but is the implications of the sort of the historical land use policies and housing policies, things like redlining and where people were allowed to live, and how home ownership and wealth building pathways were different based on race, and how that continues to explain some of the wealth and income disparities that we still see today. There's been good work done for major cities in the US, places like Portland. There's been less work for some of our medium-sized communities like Eugene, Medford, but those are really important considerations for explaining, why people of color are more likely to be low income, and how all of that, it helps to explain where people have segregated based on income in some ways, but also in places like Portland, there's definitely still some of the history of redlining and those things present. So I just showed a map. There's a bunch of really good work that's been done on some of that history by others And I showed a map here with a little citation. I'm sure some folks are familiar with that. But, and then the only other thing that I would say, even though there's more, is, we detected this overall increase in pedestrian injury outcomes across our time periods. And just, there's a lot of questions still to be answered about how the vehicle fleet is impacting that. It's a little bit out of the picture, or out of the realm of the social equity sort of framing here, but it might not be either, if different groups might own different types of vehicles. I don't know, we have to explore that, but we do know that vehicles are getting heavier, and that's presenting greater risks to pedestrians. And not only are they getting heavier, but their design features, things like big grille guards, taller front ends of vehicles, that really presents more risk to pedestrians. And a bit of a non sequitur to the overall conversation, but things that we're also exploring as a part of our study. There's some limitations. I've kind of tried to touch on those as we've gone, but the sort of ecological approach that we're taking, where we're looking at where injuries are occurring, and we're looking at the underlying residential information. There are limitations to that. I tried to point out, we might be catching people who are injured in a track, but they might not live there. I mentioned past research that's shown that, at least half of pedestrians are struck within a mile of their homes. That's even a shorter distance for children and older people. I think the research has shown that it's like a half a mile. Young people, children and older people are struck within distance of their house. And so tying the two, I don't think is super spurious. And also there's this issue of like these high concentration tracks. Don't love the word concentration for this, but it's the best word I've come to describe this. But these tracks are grouped, right? And so the high tracks you can see in Portland, they're all kind of grouped together. And so it's likely that if you're not being struck in your own track, it might be that you're being struck by one or two over, and still means that there's probably some relationship with some of the underlying census characteristics. We really need better data on where, another limitation here, and I pointed out a couple times, and is that we really need better data on where our assets are. We're working on some ideas for how we can do that. It really just requires ODOT and our partner agencies to be deliberate about tracking these infrastructure pieces. And then the other piece is making sure we're doing a better job monitoring the travel activity of these non-vehicle users. We have count programs for cars. We should have count programs for at least pedestrians, if not bicyclists. We should have better unification of where our transit riders are riding. We have some data standards for how we can put those together, but we just don't have a state database to do that. There's some really good work by Matthew Barnes in the transit division, who's worked on trying to get the state to put all those data together. But I'll leave it there with hopefully enough time for some questions if folks have any.
Thanks very much, Josh. I appreciate this. I'm sure everybody does. We do have some questions. I'm going to start with, where does the research center fit into ODOT's org chart?
Yeah, we are in the policy and data, that new group. Sorry, I haven't got that totally internalized yet. Previously TDD. And so we sit at the Mill Creek building.
Awesome. Can you tell us, how does this, or how should this research affect our broader work? Where does it live, or how would people know about it?
Yeah, I think ODOT staff get to decide that. We have a technical team that gets to decide that. I think leadership that are exposed to some of these findings get to decide how this informs our work. My perspective, this is one of the nuts and bolts of why equity is important to everything that we do, and how we pick projects and how we prioritize how we spend our money. But I'm just the researcher. I'm just generating this information and hoping people will take some of the lessons and apply them in their work. So, I'd be interested in knowing how some of this could inform your work, and what questions you might still have that would be useful to have answered as a part of some of this work that could be used in the business lines that you operate in. So maybe not a conversation for now, but if anyone's interested, I'm always happy to have those conversations offline.
Thank you. There's a chart that explains growth and exposure by vulnerability category. The chart explaining growth, so I don't know if you want to go back to that chart, but the chart explaining growth and exposure by vulnerability category is really powerful. Going back to one of the earlier slides, do you have a sense of the mode choice? Oh, it moved. Do you have a sense of the mode choice drivers for the different income race categories where we see disparities in the income categories? Looks like the most pronounced is higher income.
I didn't catch the, was that a question about what's the income of the driver? Is that what the crux of that?
Do you have a sense of the mode choice drivers for the different income race categories?
Mode choice driver. So like why they're choosing those.
Yeah, Josh, that was me. It was one of the earlier slides where you had the different race categories stratified by income levels, and then the mode choice differences between those income categories.
Trying to
And
find
the
it here.
differences among mode choice were more pronounced. It was the next chart over. Yeah, were more pronounced in the higher income categories. And I was just wondering if you had a sense of what was driving those mode choice decisions.
Yeah, I mean, I think it comes down to cost is the big one, right? Vehicle ownership and operation is expensive. And then, I mean, that's a huge one. I mean, that's what we know in a lot of our travel activity modeling work. The other parts that come into this are, you know, availability of things like transit service. The more transit service that's available to you in your neighborhood, the more likely you're going to be to use the bus or take transit. You know, at any given time, there are sort of like other types of conditions like the cost. I guess it still gets into the cost, but whether or not fuel and other inputs to driving, those costs can change, and that's going to dictate your day-to-day decisions. Cost, I think, is the big driver, and the point that I'm trying to make with this chart, with this table. It doesn't explain everything, of course, but I mean, the built environment generally, right? I mean, so transit service access, but then also how close amenities are to, your, how far apart your destination is from where you're trying to get. If you live in a neighborhood with a lot of stores and businesses, then you're probably going to be able to walk there. You'll be more likely to walk there than if you live in a suburb where there's really kind of nothing around there. Although for recreational purposes, right, the proximity to parks and off-street trails and that sort of thing are going to dictate those types of recreational non-mobile.
So this is a comment, but there's a question that I'm going to follow up right behind it. So for our vocabulary, it's interesting to think about the differences between danger, exposure, risk, threat, hazard, and other key terms. Josh did a really good job today of framing pedestrian harm in these terms, and I think that's key to our equity work. So a question to kind of follow up on that. Can you talk more about how we can better estimate frequency of walking and biking along roads to inform risk and needs? Are there data sources that we could tap?
Yeah, it's tough. Cars, there's a right of way, you put a tube down and the car drives over it, and it's simpler. For pedestrians, we got two sides of the road, we got each sidewalk. Sometimes people, will cross not in the places that we expect them to cross, so it's more difficult. We've done some work. We finished a project recently. We're about to publish the report looking at Bend and helping them set up both their bicycle and their pedestrian travel, their bike and their pedestrian count programs. And so there are devices out there that we can deploy and that we can capture that activity. And we can use those samples of counts and sort of do what we do with motorized traffic and estimate that activity across the whole system. We need to be more diligent about setting up those count programs. ODOT did just adopt a new traffic count software that has the modules in it to accept these types of data. So that's a big step forward, but we really need to dedicate agency resources to organizing with our local partners, because Central Lane, City of Portland, Bend, Medford is interested in doing these types of traffic count programs, but they just don't have the resources to do them on their own. And so, we have a great institution at Portland State University that has the Bike Ped data portal that can assist with some of this or be a resource. And so we just need, I think, some leadership to pull us together, make this a priority, and set up the program. We're hopeful that there's some shortcuts on the horizon. We have a research proposal in the queue right now to look at how you use push buttons at signals to estimate activity. There's been research done at Utah DOT that shows that they're pretty reliable measures. Once you do a little bit of factoring, those push buttons, you got to stop counting after one because everyone sits there with their elbow and keeps tapping it. But for the most part, they're good proxies. And so there are other third-party data from like mobile phone sources that I think we could also bring in as a way to help to monitor this. There's some equity issues within that actually, but I think, we could spend a little bit of resource and make this a priority and come up with some pretty good measures of pedestrian activity across the state if it were a priority for the agency. It's technically feasible.
It sounds like the populations we're focusing on are small. You mentioned in the beginning of your presentation that it's hard to even measure the impact. Is doing the right, I'm gonna guess I was supposed to say doing the right thing, maybe doing the right, maybe not. Doing the right, going beyond our work.
What I gleaned from that was that this isn't, one of the points I'd like to make, and I pulled up this table here, is that, within this category of high concentration, it's 1 million people. It's not it's a quarter of the population. We shouldn't, it goes without saying, but the same type of conditions that exist in these neighborhoods, it's just as likely that people from outside those neighborhoods are also being influenced and impacted by these conditions. And so, we're measuring 1 million people live in these tracts, but everybody is probably interfacing with these at some point too, some of these conditions. And so maybe not on the, more travel activity side, but, being exposed to some of the traffic and lack of safety features is also, I think, something that's broader than just people who live in poverty or just people of color. I'm not sure if that nailed that question or not, but.
And then this will be useful for our info for our future EAs and EISs in the state. You said there was not a database currently for ped safety assets. Is that correct?
That's right.
Who would be the SME for that kind of pedestrian info in the future, or planning as well as EA and EIS projects?
What would be the what? I'm sorry.
Who would be the SME for this kind of pedestrian info?
Well, I think we just there's been an issue about like data standards, like how do we get the whole state to collect the data in the same way? So that's kind of a technical thing. But we can develop that, and I really think the issue is just about priority, and for folks who followed the STIP conversation the last couple of weeks, we have a lot of priorities and don't have enough funding for everything, and so data is something that in data management or those types of things that usually fall off first when we're making cuts and prioritizing things. So I think we just have to make the case for why these data are important, come up with on the back end a way to manage the data, and then get our partners at the local level to help with that, and either through technical assistance or funding, so that we can pull these data together and do that on an ongoing basis. We have a really cool project also in the hopper that is aiming to use, we drive these LiDAR trucks, that's like shoots lasers all over the place to sort of measure the built environment. We do that for monitoring landslides and a couple other things at ODOT, but we drive that truck around the whole state system every 2 years. And we have a research proposal that's hoping to take those data and turn them into measures of the infrastructure, everything from where the motorized stuff is, where the pavement markings are, where the signs are, but also where are the crosswalks. We have to just determine whether we can actually measure where the sidewalks are, if we can measure the quality and that sort of thing. So making a data collection program like that a priority, I think would be and working with our local partners would be a kind of a shortcut for getting to some of these infrastructure assets and managing them. But again, it takes leadership and priority.
Awesome, thank you. That's the end of the questions I have. Does anybody else have a question for Josh?
And just to put in a plug for the TSAP process. So the Transportation Safety Action Plan will a memo that'll be coming out mid next month that summarizes some of this. So there'll be kind of a document that folks can access, as some of this information in it. I think maybe presentations are going up online too. And if not, I'm happy to share any of these, any of the information from this presentation through that too. So.
Yes, they are. So thank you very, very much, Josh. We really appreciate you sharing this with us. Someone asked, are these presentations being posted on the ODOT website for social equity? Yes, they are. If you go to, I can actually put the link for it into the chat. Obviously, Josh's is not there yet, but the rest of them are. It's the entire recording. So you can see if people shared screens or did presentations, you can see them there. And then also, if it's something that you think would be helpful, if you would like this presentation from Josh, I'm sure he would share it with you. So what we're doing on the internet is all of the presentations are there, and then we're also creating a resource page to dig in deeper to some of the things. So like from this one in particular, some of the vocabulary that was shared in terms of danger, exposure, risk, threat, and hazard, there'll be a piece that really talks about or helps us think about what that could mean based on the social equity series. And that'll be up there in January. So we still have 2 more left next week, even though I know people are on vacation as such. I keep telling you, feel free to join from your couch or put it up on your TV screen for your whole family to join us for a social equity series. We're doing the lessons learned from pedestrian. Oh my goodness, this could be my mind. We're doing lessons learned from Leanne Ferguson and Jessica Horning. Safe Routes to School. We're doing lessons learned from Safe Routes to School, and then the week after that, we're doing our final chat and chew. And AJ, if you haven't met AJ, will be facilitating that. AJ is the intern from Social Equity, and they'll be facilitating. Lindsay, she'll be joining us. Travis Brower will be joining us, and I will be the people talking for that final one. And that will wrap our year up, and we will be back next year with different things and different themes. So I really appreciate you all joining us each week. Feel free to look at all of them, again, are up right now, and we will continue to put more resources on that site. Josh, people are thanking you for your presentation. I thank you as well. I'm sure you can't hear the claps, but the crowd is definitely roaring. And we appreciate you. Hope you all have a great rest of your week. And if you do not join us again, and you're going somewhere, even if it's just in your home to hang out, Happy New Year. Have a good day, everyone. Bye.